So the question is, I don't know if you could hear Sandra in the background, if somebody has any issue, I presume, what should make me want to go to the emergency room versus the walk-in clinic?
Which is a very broad question, right? So there are some things that are crystal clear. If you have signs of a stroke, if your face starts to droop abruptly, if you are unable to move your arm, if you're slurring speech, if you're stumbling, you need to be...
Crushing chest pain.
Crushing chest pain for cardiac disease, right.
Call 911. I mean,
you call 911, exactly. And especially, and I want to put in this plug here, when it comes to the potential for a stroke, if you call 911, because the treatment that we can do for a stroke in the emergency room is very time dependent. It has to happen very quickly.
And with heart attacks as well.
And with heart attacks, stroke is a little bit shorter, and people are more likely to try to ignore stroke. I mean,
yes.
So my feet are stirring a little bit. That's not painful. It doesn't have the same sense of urgency.
I think I'll get better if I just wait a little bit.
Exactly.
Right. Big mistake.
And And if you call 911, they can have the stroke team ready to go in the emergency room.
In fact, when we're working in the hospital, we'll hear overhead there's a stroke alert because the team is pulled in together well before that patient even hits the emergency room.
Exactly.
The other thing is that the EMTs in our area start care at the site.
Exactly.
Right. You'll be given specialty medicines, you'll be given oxygen, oxygen levels in your blood will be tested. The critical information that's necessary by the time you get to the hospital is already known by the ER doctors before they get there. And treatment that's likely to treat a stroke or a heart attack has already been implemented, and those seconds save lives.
It does.
But let's presume that somebody does not have any of those things.
So let's move on to other things. On the orthopedic field, if you have a bone sticking through your skin, if you have an obvious deformity, you need to be in the emergency room, because those are things that the emergency room docs can handle. Orthopedists are on call to do that immediately. If you're a little short of breath, that's something that we can probably handle. If, on the other hand, you're an asthmatic and you are getting lightheaded and you're turning blue, those are things that need to be in the emergency room.
Quickly.
And quickly. And if you have questions, you can call us during the time that we're open, and we will advise you on that. I mean, I am no more interested in having someone who's actually in the middle of a heart attack walking into my office than they are in not being where they need to be. Now, if they do walk in, I'm going to be able to provide them some services and help with that while we get 911 there.
Right.
But I'd rather they not show up.
Right, sure.
And
because
I
those
can-
seconds saves lives.
Right.
The-
And I can tell a story from some years ago when I was working in a family medicine clinic, and a woman was having chest pain, so her daughter had called and gotten an appointment with us and was driving her mom to my clinic when her mom collapsed about 4 or 5 blocks away. So the woman kept on coming and pulled her mom out into the lobby, basically. And so we go rushing down, and this was not a patient we'd seen before. And trying to resuscitate her, she did not make it by the time the EMTs got there. But that was one where what her daughter described was the classic heart attack symptoms. Her mom was having like an elephant sitting on her chest. It was going down her left arm. She was sweating. She should have called 911, and she might have survived.
And not drive somebody yourself, because if they have a VFib, they go completely unconscious, and there's
Exactly.
nothing you can do.
And there's nothing that you can do if you're driving down the road.
No.